Your doctor has decided to start you on warfarin. You probably want to know what warfarin is and why you need to take it. During the next several minutes, we will help you answer these questions and more. Warfarin is a medication that reduces the body's ability to form blood clots. Usually your body will form a clot when you injure yourself, such as when you get a cut or a scrape. This normal clotting prevents excessive bleeding. However, in your case, you have a medical condition that may cause your body to form clots you do not need. Some of these medical conditions include atrial fibrillation, which means your heart does not beat correctly. A heart that beats irregularly may cause blood clots to form in the heart. Artificial heart valve. These valves direct blood flow through the heart. Blood clots may form around or on the surface of these artificial valves. You may have a clot that is formed in your leg, sometimes called a deep vein thrombosis or DVT. These clots may get bigger and possibly travel to other parts of the body and cause injuries. Some people are put on warfarin after having specific types of surgical procedures, such as a hip or knee replacement. They may be at risk for clot formation during the weeks or months following the surgery. In all of these conditions, if a clot forms and breaks loose, it may cause serious problems. If a clot moves to the brain, this is called a stroke. If a clot moves to the lung, liver, or kidneys, it may damage the organs and cause them to work incorrectly. If a clot moves to the heart and blocks the blood vessels around it, you can have a heart attack.
Bye-bye. I've been taking warfarin for more than 15 years. It's easy. I take my doses as my doctor tells me, and if I have any questions, I call my doctor.
Warfarin works by increasing the time it takes to form clots. Warfarin has helped many people, but if not taken correctly or not monitored, it may cause harm. It is important to talk to the healthcare provider that monitors your warfarin therapy. This could be your doctor, your nurse, or your pharmacist. Follow your healthcare provider's directions and let them know exactly how you're taking your warfarin. The dose you're taking will be adjusted specifically for you. You will need to have regular blood tests to make sure you're on the right dose. The lab test checks the international normalized ratio. This can also be called the INR, prothrombin time, or ProTime.
Warfarin lab tests are very important. They help your healthcare provider see how fast your blood is clotting. Each warfarin patient has their own warfarin blood test range. Your healthcare provider will tell you what your range is. If your test result is higher than your target range, it means your blood has too much warfarin, and you may notice some bleeding or bruising. Your dose may need to be decreased. If your test result is less than your target range, it means you're not taking enough warfarin. Your dose may need to be increased. Your lab results will help your healthcare provider determine if a dose change is necessary. When you first start warfarin, you need to get your blood checked once a week until we get the right dose. After that, it should be checked every couple of weeks. All right, you're all set. Thank you.
It is also important to know that you should try to keep your diet as consistent as possible while on warfarin. Warfarin works by blocking a factor in your body called vitamin K. Vitamin K is found naturally in foods like green leafy vegetables, such as spinach and broccoli. Eating a lot of foods with vitamin K may make the warfarin lab test too low. However, you do not have to stop eating foods with vitamin K. You simply have to keep your diet consistent. For example, if you eat salads or greens on most days of the week, then keep this consistent from week to week. If you happen to have any changes in your normal diet, let your healthcare provider know.
I eat a green salad every day. If I eat more or less than usual, I make sure I tell my pharmacist in case I see any changes in my blood test.
Also, some medications and herbal supplements may interact with the way warfarin works. Make sure to tell your healthcare provider before you start or stop taking any non-prescription or prescription medications and supplements. While you are taking warfarin, it is a good idea to consult with your healthcare provider before you try a new activity or sport. There are some activities your healthcare provider may want you to avoid because of the high risk of bleeding if you have a serious fall or injury. Another important thing you should know about warfarin is that it may cause bleeding and bruising. Warfarin increases the time it takes for your body to form clots, and that's how it lowers your risk for medical problems like a stroke. But because warfarin makes it harder for your body to form clots, you may bleed more when you cut or injure yourself. That's why it's important to take warfarin just like your healthcare professional tells you.
My pharmacist told me to look out for certain things, like excessive bleeding when I brush my teeth or if I notice any bleeding after I go to the bathroom.
There are some side effects you should look out for. You may start to see more bruising than usual, and you may notice that these bruises will take longer to go away. This is normal, but if the bruises get darker and larger, let your healthcare provider know. You may notice some minor bleeding, like nosebleeds and bleeding in the gums when you brush your teeth. Contact your healthcare provider if the frequency of these events increases or the bleeding does not stop after a few minutes. If you notice dark urine or dark stools, let your healthcare provider know right away. All of these side effects may indicate that your dosage of warfarin may be too high. It is important to keep an eye out for these side effects. It is a good idea to get into the habit of taking your warfarin at the same time every day. There are 9 strengths of warfarin tablets, so make sure you always verify the strength before you take your dose. Each tablet has the strength printed on it. Each strength tablet is a different color. Verify the tablet strength and colors each time you pick up your warfarin prescription from the pharmacy. Since your dosage of warfarin may change from time to time, make sure you take the right dose on the right day. To help you keep track of your dosage, you may want to use a pill box or a dosage calendar.
I take 5 milligrams on 3 days out of the week and 2.5 milligrams on 4 days out of the week. Sometimes this changes, so I write everything down on my calendar to help me keep track.
There are important things you should do as a warfarin patient. Let's review some of these. Take your warfarin exactly as directed. Get your INR checked as scheduled. Watch for signs of bleeding. Keep your diet consistent. Contact your healthcare provider if you experience difficulty breathing or chest pain, coughing or throwing up blood, a serious fall or head injury, illness, fever, or infection that worsens, swelling or pain, weakness or dizziness. There are things you should not do while on warfarin. If you miss a pill, do not take an extra pill to catch up unless your healthcare provider directs you to. Avoid excessive alcohol use or binge drinking. Do not make any major lifestyle changes without consulting your healthcare provider. If you are pregnant or plan on becoming pregnant, do not take warfarin. We have covered a lot of information about warfarin. However, you may still have some questions that are unanswered. Ask your healthcare provider for more information regarding your specific warfarin therapy.